That way I won't forget to do it, and make you redo part of your program. Okay, it is 12 noon, according to my clock. I'd like to welcome everyone to the Beef on Dairy Dialogue webinar series. It's an extension of the annual Dairy Beef Short Course held in conjunction with Central Plains Dairy Expo each March. The short course is the longest running program focusing on steers with dairy genetics in the U.S., with 15 years of continuous programming. The short course is sponsored by the I-29 MU University, a consortium of extension specialists from Iowa State University, University of Minnesota, University of Nebraska at Lincoln, and South Dakota State University. The I-29 MU University Beef on Dairy Dialogue series continues today with Dr. Catie Cramer, who will be discussing how transporting newborn dairy calves can be a bottleneck to success if not managed correctly. The presentation will review how early life transport can impact calves, management practices that can help reduce the negative consequences, and review supply chain considerations. Dr. Cramer is an associate professor in the Department of Animal Sciences at Colorado State University and has been on faculty since 2019. She received her MS and PhD in dairy science from the University of Wisconsin-Madison, where she focused on dairy calf health, welfare, and behavior. The overall goal of Dr. Cramer's current research program is to identify effective solutions that improve human and animal well-being on livestock operations. Her recent project regarding calf health has investigated strategy to prevent disease in calves and provide valuable information about the condition of dairy calves prior to and after transport in the Western United States. She enjoys productive collaborations with dairy stakeholders, students in college to co-create solutions that help dairy cattle and the people who care for them. Dr. Cramer, as I always say, the podium is yours.
Thank you for that introduction, and thank you everyone for being here today. I'm really excited to talk about this. So, as we were talking, Philip or Fred, now my slides won't advance, so bear with me one moment. Sorry, everyone.
See, the gremlins always find us.
I know, I know.
Yeah, it seems like
There,
sometimes you let it sit too long, it gets tired and it wants to go to take a nap.
there we go. We all good now?
Yep.
Looks good. Yep.
Perfect. Okay, keep your fingers crossed for me. So I've given this a version of this talk several times, and young calf transport is a bit of a hot topic right now. And so I just want to, first say that there's so much that we don't know. We really need a lot more research in this area. And I'm going to share a lot of data today, but I'm not trying to make blanket statements. Operations are unique, and data should inform our decisions on those individual operations. It's a tough topic, it's gaining more attention. And so my thoughts are really, how can we be proactive to make sure we're managing these calves well? So we'll talk a little bit about if transportation is a bottleneck to success in calf programs. I'll share some data. We'll talk about the welfare challenges of that calf at each stage of transport. And then finally, we'll end with what are some management practices that can help us minimize stress? So this series is focused on beef on dairy. And so I'm going to really focus kind of my time on non-replacement calves. So Those are our male dairy calves who've historically had low value, but as we were talking before the webinar, it's certainly not the case now. And because of that historical low value, for a long time, we saw those calves really not be managed in the same way as our replacement heifers. And then, of course, also in our non-replacement calves, we've got male or female beef on dairy calves. Many of our heifer calves are transported as well, but typically we see our non-replacements be transported at a younger age, and more of them are transported. So on a national level, we know that about 80% of these calves are transported offsite at less than a week of age. In a study we did here, we actually found that the majority of those calves were leaving the dairy at less than 24 hours of age. Those calves, they may go directly from the dairy farm to their final destination. But in some parts of the US, as I'm sure you all are aware, sometimes they can go through a marketing or calf auction or calf jockey. And they may go through sometimes up to be marketed up to 4 times before they reach their final destination. And so this really can lead to some complexities around how these calves cope with transport. And when I ask producers or calf raisers, what are your goals? They always tell me that they want those animals to be healthy and productive and profitable, and that some of the barriers to success are things like people. We know that people can be a good thing or sometimes a not so good thing depending on how they manage the animals. But another big barrier to success is disease in young animals, right? And so early life transportation can be a bottleneck to success in calf raising. So if we're thinking about how we raise healthy, productive, and profitable calves, we also know that things like disease or other challenges get in the way. So today I'm going to share data that demonstrates that transportation is stressful for our young calves, and stress in calves makes them more susceptible to disease, which in turn decreases calf performance and decreases calf welfare. Excellent management is critical, and it's going to determine if our calves are successful or not. And so we really have to pay close attention to these calves and make sure we're managing them in a way that sets them up for success. I'm going to say, well, I've already said welfare a few times, and I'm going to say it quite a few more times. And I want to provide a definition so that we're really all on the same page for that. So an animal experiences good welfare if it's healthy, comfortable, well-nourished, safe. It's not in pain, fear, or distress, and it's able to express behaviors that are important for its physical and mental state. And so I want us to keep this definition in mind as we talk through calf transport today. Keep in mind, I said that many of our non-replacements and truly many of our replacement heifers who do leave the dairy, they're transported at less than a week of age, and many times at less than 24 hours of age. And so young calves are highly susceptible to stress and disease. And one of the reasons our calves are susceptible to disease is because for the first few weeks of life, they rely fully on maternal antibodies from colostrum to help them fight disease. That calf really doesn't have high levels of fully functional active immunity until towards the end of pre-weaning. And because of the way that the calf immune system develops, they have a window of susceptibility typically around 2 to 3 weeks of age, which is when antibodies from colostrum are low, and that calf is really just beginning to have its own response to pathogens it's coming into contact with. And so one of the things we'll talk about a lot today is transfer of passive immunity. So from colostrum. If we have excellent transfer of passive immunity, particularly if we're paying attention to some of those newer more recent recommendations, and really focusing on a cut point of at least 6.2 for our serum total proteins. That window of susceptibility is going to be slightly shorter, and that colostrum is actually going to offer protection for longer. But if we don't do a good job at providing excellent colostrum, that window of susceptibility is actually longer and it can be earlier. And so that window is really influenced by how things go for the first couple of days of that calf's life. And it really highlights why it could potentially be very challenging to transport calves at this very young age. We're heavily relying on colostrum, and any stress we add to the calf increases their susceptibility of disease. So transportation in livestock species is well documented to be stressful, and it's no different in our calves. When we think about the stressors that calf is going to experience or can experience in transport, it can be things like commingling, extreme weather conditions, improper handling if we're not handling those calves well, if we don't provide bedding, they can be exposed to pathogens, and oftentimes, if not all the time, they don't have access to milk or water. And so for the calf, that can result in dehydration, discomfort, disease, energy depletion, fear, hunger, injury, thermal stress, and thirst. And so all of those are not only welfare concerns, but they can affect the productivity of that animal as well. We know that stress makes an animal more susceptible to disease. During transport, calves can experience a wide range of temperatures. They don't have access to milk and water, and they're commingled. And all of those things have been documented to make that calf more likely to become sick. It hasn't been linked necessarily in transport itself, but we know that stress in young calves, there's lots of data to support that increases their susceptibility to disease. And again, if we think back about our goals for our calf program, one of those goals is likely that those animals grow really well. And disease can impact average daily gain. And we know, depending on the disease and the severity, and lots of different factors, average daily gain losses of disease can result in average daily gain losses of anywhere from 0.01 to 1.7 pounds per day. And so that's really significant. If we're talking about our replacement heifers, for example, that pre-weaned average daily gain affects future milk production. So for every 1 pound decrease in pre-weaned average daily gain, first lactation milk yield decreases by 1,100 pounds. So that's $200 lost on milk alone. We also know that calfhood disease and poor growth during that pre-weaned period is associated with things like lower carcass quality, lower hot carcass weight, and a lower price at auction. And it also leads to an increase in additional diseases, labor costs, mortality, and treatment. And so again, if we think about our goals for our calf program and we want them to be healthy and profitable, we also have to consider how we manage early life stressors, such as transportation, because of this link between stress and calf performance. So one of the things we talk a lot about in our market dairy cows are fitness for transport. And we have a real opportunity to improve fitness for transport in our dairy calves. And I'm going to show you some data about the condition of calves throughout the transport journey. Some of this data is from Canada, but I think overall we have data that shows this is a real area where we can make some significant improvements. So that source dairy is really preparing the calf for transport. And we can decide, do we set that calf up for success or failure at that dairy? And the two things at the dairy that we really need to pay attention to are colostrum and fitness for transport, like I just mentioned. When we think about colostrum practices on the source dairy, we know historically that male dairy calves were more likely to receive contaminated colostrum, delayed colostrum feedings, and a lower total volume of colostrum. This was a study in the US that showed that transported calves, about a quarter of them had poor passive of transfer immunity. So they didn't get excellent colostrum. And that was a fairly recent study within the last 5 or 6 years. And remember, think back to that graph I showed you at the beginning. We don't just want calves to have okay colostrum, right? Our goal should be excellent colostrum. And so actually the proportion of calves that didn't have excellent colostrum was a lot greater than just a quarter of them in that study. So this is some data that we collected here. We did a survey a couple of years ago, and we asked dairy producers about their management of calves who are going to leave the dairy. And we asked them about replacement heifers, which is shown in yellow, beef on dairy, which is light blue, and bulls, which is kind of that greenish blue. And this is the overall distribution of colostrum timing based on the class of those animals. And when we look at it within operation, there were actually more operations that fed colostrum to replacements earlier than beef on dairy and bull calves. And so we are still seeing a difference here, but I do want to point out that the majority of operations were feeding within 2 hours, and I think that's really positive. Same survey, this is just looking at colostrum quantity, and I think it's really positive because we found that the quantity of colostrum didn't differ by calf class, so all calves, or most calves were getting at least 4 quarts of colostrum prior to leaving the dairy, or excuse me, this was first feeding. So I think that's really, really positive. And so what are some things we can do to kind of build on that progress? So I mentioned fitness for transport. And this was a study we did here in Colorado, and we looked at the condition of calves when they were getting loaded onto the trailer and then when they were unloaded. Most of the calves in our study were less than 24 hours of age. And we found that at least almost half of them had at least one health abnormality. And the most common diseases that we saw or conditions that we saw were dehydration, diarrhea, and a depressed attitude. This is, again, survey data. So that same survey I was just talking about a few slides ago. We asked dairies, would you still ship a calf if it had X condition? And so this graph is showing, for example, anywhere from 20 to 30% of producer respondents said that they would still ship a calf if it had diarrhea. About the same proportion for dehydration, 35 to 55%, depending on the calf class again, said that they would ship a calf if it had navel inflammation. And then 30 to 40 said they would still ship a calf if it has not received the minimum feedings of colostrum. And so when those sick animals or injured animals, they have a unique set of needs, and that's really impossible to provide during commercial transport. So when we're transporting sick or injured calves, that greatly affects their welfare. Those stressors are compounded and disease conditions can worsen. And not only does it affect the animal while it's on the trailer, but we see long-term impacts of that as well. So if calves had navel inflammation at the source dairy, they were 2.8 times as likely to get diarrhea at the calf raiser. If they were dull or depressed at the dairy, so getting on the trailer, they were 2.5 times more likely to die at the calf raiser. And so again, if we think about our goals, um, how do we get healthy, productive, profitable animals? We're really seeing these decisions that we make at the dairy when that calf is not even 12 hours old yet affect that calf in the short term and also the long term. Now I'm going to share some data about or share some of the challenges that those calves experience while on the trailer itself. Um, so as I mentioned, milk and water typically aren't provided on the trailer. We've got improper handling again, if we're not doing things correctly, lack of bedding, pathogen exposure, commingling, extreme weather. All of those things can lead to things like dehydration, energy depletion, discomfort, injury, disease. And so we've got some significant welfare implications. And remember, we're asking a calf who is many times less than 24 hours of age to overcome these stressors and go on and live a productive life. When we look at the marketing process, that can present additional stressors for calves. Over 70% of calves who are sold go through auctions, and oftentimes there's not access to milk or water at those facilities. This is data from a Canadian study, and they found that 20% of calves arrived at Canadian auctions with at least one of the following. So navel disease, eye or nose discharge, depressed attitude, unable to stand, a cough, or swollen joints. And now finally, we'll talk about the condition of calves when they arrive at their final destination. So at that calf raiser or at that calf ranch or a veal facility. So a study here in the US that's really just a few years old, they looked at bob veal, and they found that 96% of those calves had at least one abnormal condition, and 82% had at least two abnormal conditions. And those were things like low blood sugar, dehydration, really thin calves, failed transfer of passive immunity, depression, etc. In our study, where we did it in Colorado, where we measured the condition of calves getting on the trailer and getting off the trailer, we found that over 56% of calves were dehydrated getting off of that trailer. So this is the same survey I mentioned earlier that we did a couple of years ago, but this time in this slide is showing the proportion of calf raisers. So we actually asked calf raisers, what have you had at least one calf arrive with any of these abnormal conditions? And 75% of those calf raisers said they had at least one calf arrive with diarrhea, 65% with navel inflammation, 60% with dehydration, 60% said they had at least one calf arriving with difficulty breathing, and so on. And so I want to say that, this is the proportion of calf raisers. Ideally, we would know the proportion of calves, but really one calf is one too many, right? And so again, if we think about our calf goals and setting those calves up for success, having those calves get off the trailer in poor condition is not normal. And so we have to manage them effectively so that they can withstand that journey and that it doesn't negatively affect them. So just to summarize, we are seeing sick or injured calves at each point along that journey. And so transportation is stressful for calves, and it's exacerbated when we ship calves in suboptimal conditions. So shipping calves who are sick or injured. And again, I keep coming back to this slide, but I think it's so important to remember this link between stress, disease, and performance and welfare. And so I think we have, the data really demonstrates that we have ample opportunities as an industry to improve how we manage calves before, during, and after transport. And so how do we do that? I'm going to talk about 6 strategies, and the first 4, we can and we should do those now. The last, number 5 and number 6, are more difficult, but they have a huge impact on those calves as well. So we'll first start with the first 4, and those are things we can and we should do now. And so the first one is focusing on preconditioning. So preconditioning, we often hear about it in the beef industry. And I'm using that term here because I think it's a nice way to think about what are some management practices that we can do to help those calves succeed during the next phase of their production, like transport and at the calf raising facilities. And so the first one is colostrum. There are some newer recommendations coming out that suggest we still want to reach that 300 grams of IgG within the first 24 hours, divided into 2 feedings, but really focusing on feeding higher quality colostrum in a smaller volume, because that's going to increase the efficiency that calf can absorb. So an example would be our first feeding 3 quarts of at least 25% Brix within the first 2 hours of birth. And the second feeding would be 2 liters of at least 22% Brix colostrum offered 12 hours later. And so making sure that, again, we're setting that calf up to have excellent transfer of passive immunity, so that window of susceptibility is shorter and longer, and our colostrum is really providing optimal benefits for that calf. We talked about how calves arriving with a navel infection were more likely to get diarrhea at the calf raiser. And so really focusing on disinfecting navels and navel care. That umbilicus is really going to act like a wick. And so anything that is in the environment, it will kind of take up, and it can go directly to the liver and the bladder and cause some pretty significant issues for that calf. So not only disinfecting those navels, but making sure we're focusing on a clean environment to, again, set that calf up for success. And the final thing with preconditioning is milk and water before getting on the trailer. So we want to provide a milk feeding as close to transportation as possible. That's going to allow that calf to maintain those energy reserves throughout that transport journey. And we know that milk does that better than just electrolytes or just water. Milk is really what can help sustain these calves. And so one study looked at providing 2 3-liter milk feeds. So they fed the calves the night before and then the morning of, compared to just the morning of. And that actually didn't fully eliminate, but it reduced the negative impacts of prolonged fasting. So again, really setting those calves up for success and making sure that they're on a good plane of nutrition before they get on that trailer. And then also what we don't want to be doing is tube feeding calves a ton of milk or colostrum just because they've got to get on the trailer. And so we really want to use caution when doing that. It's not without consequences, and making sure that producers are working closely with their herd veterinarians to make sure that we're again not doing more harm than good for those animals. So next is assessing fitness for transport. So I showed you a lot of data that shows that there are calves being transported in not good condition. And so fitness for transport is really about an animal's ability to withstand transportation without compromising their welfare. It's largely talked about, like I said, in our market cows, but we need to start talking about it in calves and we need to start assessing it in calves. So calves are well prepared for transport when they've received high quality colostrum in a timely manner, when their navels are disinfected, um, and when they have access to milk and water. And they're not fit for transport when they are dehydrated, sick, or injured, if they're lethargic or depressed, if they have navel swelling, or if they're unable to stand on their own. And so this is from a paper looking at transport in beef cattle, but I really like it. It says animals least fit for transport suffer the greatest losses in terms of welfare, while market-ready animals in good condition appear to have fewer issues. And so again, I think it's important for us to keep in mind, like we want to assess fitness for transport in our market cows. We should have the same system for our calves as well. Next is handling calves with care. So going slow and being patient, being gentle, and thinking about the time of day. So if it's really hot out, can we ship them during a cooler part of the day? And the season as well. If it's really cold out, can we add some extra bedding, calf jackets? Can we close up the slats on the trailer to help those calves get through that a little bit easier? Making sure they have plenty of clean, dry, and deep bedding, and then lying space. We have data that shows that calves are going to spend over 70% of their time on the trailer laying down. And this is specifically for calves less than a week of age. And so making sure that every calf can lay down on the trailer comfortably and that they can all lay down at the same time. That's also going to help them maintain energy reserves for longer as well. Next is post-transport care. So what do we do for those calves when they get off the trailer? So we can work with our herd veterinarian to develop health protocols, but we really first need to assess and promptly treat sick, dehydrated, or injured calves. And so, that doesn't mean giving an antibiotic to every calf that gets off the trailer. That means really assessing them and seeing what they need, what their condition warrants, and how we can provide that for them to provide them some supportive care as well. There's just been one or two studies looking at post-transport nutrition, and they found that 2 days of oral electrolytes after transport, in addition to milk, so not just electrolytes, but milk plus 2 days of oral electrolytes, 2 feedings per day, improved moderate dehydration compared to just milk. And another study looked at some different kind of diet components, and milk replacer was better than a whey-based diet with electrolytes, which was better than glucose electrolyte diet. And that was in terms of blood glucose, energy, and hydration. So again, seeing milk replacer outperform electrolytes. But if we add electrolytes in addition to milk feedings, that can improve moderate dehydration. The last two we'll talk about are retaining calves on the source dairy for longer and reducing transport duration and events. These are hard to consider, but they're really important. And in fact, when we look at transportation regulations in other countries, the primary things that they regulate are the age of the animal and the duration and number of events of transport because of the significant impact those things have on the animal. And so keeping calves at the source dairy for longer, that really means waiting until that calf is a little bit older to ship. The first two bullet points here are from a Canadian study, and they looked at 3 different age groups of calves. So they had 2 to 6 days of age, 7 to 11 days, and 12 to 19 days of age. And those calves who were who were 2 to 6 days of age, or excuse me, calves who were at least a week of age at the time of transport had greater average daily gain during the first 50 days at a veal facility and reduced incidence of abnormal respiratory score. So those calves not only outgrew, but they also they didn't develop as much disease as those calves aged 2 to 6 days of age. Similarly, compared to calves 2 to 6 days of age, calves who were 12 to 19 days of age had reduced odds of navel inflammation. In the US, and so you'll probably notice that that Canadian study didn't include calves who were less than 24 hours of age. But we did a study here in the US, and when we compared calves less than 24 hours, calves who were at least 1 to 3 days of age at the time of transport had a reduced odds of being dehydrated prior to transport. And in fact, we found that just one more day at the dairy reduced the odds of that calf being dehydrated by 5 times. And so that's pretty significant. I know that this is, really difficult to implement, and there's lots of considerations, but I think we have to keep this in mind if we really, again, when we think about our goals of our calf programs. Next is reducing transport duration and the number of events. So the longer the calf is on the trailer, the longer it's exposed to all those stressors, and the harder it is on those animals. And so this is a Canadian study, and when they looked at different durations of transport, calves who were transported 16 hours compared to 6 hours had higher levels of dehydration. They lost more weight. And not only were they dehydrated and lost weight during that trailer ride, but they saw those effects last for 2 weeks into that calf raising period. So those calves who were transported for longer had an increased incidence of diarrhea in those first 14 days after transport. The other important thing to consider is that distance doesn't equal duration. And what I mean by that is, so for example, in one of the studies we did here, the calf raising facility was about a 40-minute drive from most of the dairies. But some of those calves were on the trailer for up to or over 8 hours, because if you're the first calf on the pickup route, you're going to be there while that driver goes around and picks up all the other calves. So just keeping that in mind, like just because the calf is maybe only going to somewhere that is 50 miles away, doesn't mean that it's not going to be on that trailer for quite a bit longer. So also thinking about, is there an opportunity to do direct to destination, so not going through that marketing process, and operations closer to the dairy farm? Again, I recognize those are really difficult to implement in our current system, but they are something that we need to consider. And so where do we go from here? I think first and foremost, we have to increase communication among our supply chain sectors. There's a lot of calf ranches or calf raisers that are giving feedback to their dairy clients or their source dairies on the condition of calves. But I think the more that all sectors begin to talk to each other, the better. Training programs for calf transport is virtually non-existent. We don't have any that I'm aware of. And so I'm really trying to make sure that we have some of those programs in place. We really want to manage calves to minimize stress. And, there is so much that we don't know. And we really need a lot more work in this space to figure out how best to manage these animals. But we do know that we can focus on preconditioning, making sure we're only shipping healthy, vigorous calves, handling them with care, caring for them post-transport, and then also thinking about things like waiting till calves are older to ship them and having them on the trailer for a shorter amount of time. So again, if we think back to the slide that I've showed several times now, again, if we think of our calf programs, early life transportation can be a bottleneck to success in calf raising because of the link between stress, disease, and reduced performance and welfare. But excellent management can reduce stress if we do things correctly. So I just want to acknowledge many of my graduate students, my collaborators who have helped with many of these projects. And with that, I would be happy to take any questions if there are time for questions. So thank you.
Thank you very much, Dr. Cramer. Yes, we definitely have time, and we're a small enough group. If folks, they can enter into the chat box or just unmute and ask the question directly. I'll go ahead and give just a second to let people step up with questions. Otherwise, we've got some questions that have already came in. Okay, well, people are putting their thinking hats on. Uh, should calf buyers be demanding blood assays or a proof of health? Is that a reasonable thing for a buyer to request?
Sorry, can you repeat that question? You broke up just a little bit.
Oh. Should calf buyers be demanding blood assays or proof of health when they're buying these calves that have been in transport?
Yeah, so um, a couple things on that. There are a lot of calf raisers that do, as routine, take total protein samples on their calves at arrival, and then that can be one of the things that they um, uh, give feedback to for their dairies. It could be tricky to get that blood sample prior to transport, particularly if they're leaving the dairy at less than 24 hours of age. That's not a, that wouldn't be accurate. And so I think it's one component. It's a really important component, but it's one component of animal health. And so really looking at how those calves are performing overall. Um, and you could do some blood samples on that.
You had talked about the space requirements. Do you have an ideal group size in pen transport, especially square foot per calf? Have you got a number there?
Yeah, I do. So, um, from an industry perspective, there isn't really a recommendation on the trailer. Um, what we want is enough space for all calves to lie down comfortably without the risk of being stepped on by other calves. So beef quality assurance for a 200-pound calf says about 3.5 square feet. The Vermont livestock care standards in Ohio State say about 4 square feet for calves up to 2 months of age. That's still pretty small, but again, the goal is that we want enough space for all calves to lie down comfortably.
Okay, I'm not seeing a question in the chat box again. If you have a question, just unmute, go ahead and ask. You, okay, Erica, what are your suggestions to convince dairy producers to provide optimal preconditioning for the beef on dairy calves if they are in a situation where this is not incentivized?
Mm. Yeah, I think um, that's a hard one because in an ideal world, um, they would do it because it's best for those animals. I would say, are there some things that we can do to just even move the needle a little bit? So maybe not focusing on everything at one time, but maybe just a little bit of movement at each time. I would say that, uh, you know, calf raisers, there are some that are doing incentives or disincentives for the condition of calves that they receive. But if that's not in place, I think, ideally, like I said, it's the right thing to do for that calf. And they would ideally implement some simple changes to just move the needle just a little bit, just improve it incrementally for those calves.
Okay, thank you. Um, you'd mentioned that prior to putting the calf on the truck, the making sure they have a milk or a colostrum feeding to maintain nutrition. Should dairies be actually pre-treating calves with a medicated milk replacer or an antibiotic before loading? Is there a benefit to that?
Um, I would say no, there's not data that would support that. And I think also we want to make sure that we're managing them in a way that again sets them up for success. And if we're using antibiotics kind of as a crutch, for example, like in a day old calf, I think we really have to look at what are we doing from a management perspective that's making it so likely for those calves to get sick rather than pre-treating them with an antibiotic.
I know we're all looking for those articles where welfare activists are asking for things, but help us understand, are there things the welfare activists are asking for that is actually different from good welfare for profitability?
So I guess maybe I would, to me, like a lot of activists are more like animal rights and animal welfare are different things. And I think that um, in situations like that, we have to ask ourselves, is what we're doing a defensible practice? And if it is, how can we have a respectful conversation with someone who may not agree with us? If things are not defensible, how can we adjust our management proactively in order to um, make it so that it's better for those animals? If we take good care of the animals, they will take good care of us.
Very good. I see Steve unmuted. Have you got a question for us, Steve?
Steve, yeah, thank you. Steve Eicher. I've been working with large dairies that ship to calf raisers regularly. Are you familiar with Riverview Dairy? They ship 300,000 or 400,000 calves a year.
Yep.
Their death rates and disease rates are way under 1%. They ship them for 17 hours at a couple days of age. And there was just a recent paper published by Gustavo Schernemann, what I forget in what journal, but I can post the API. But I think using the Canadian system, where it's small dairies that ship to a commingled place, is way different than a large dairy that ships an entire trailer load of calves directly there. And you know, I don't think we can beat Riverview's success statistics.
So I'm familiar with the paper you mentioned.
Oh, good.
And I think I'll maybe take that question in a couple of pieces. First, I agree with you. We need more data in the US. The data I shared is what we have. And that might not be the case for every calf, but it is the case for a lot of calves here in the US, particularly in like the Midwest, where a lot of those calves are going through an auction facility. In fact, most recent USDA data we have shows that 70% of our calves who leave our dairies go through marketing. And I should say 70% of our non-replacements go through marketing.
Okay.
And so that is a proportion of calves in the US. To the other point, the whole point of this talk was to say that transportation is stressful for calves, but we can manage them in a way that minimizes that stress. And so that system that you mentioned, those calves, at least to my knowledge, are a few days older when they're shipped. They're only shipping those calves who are in good condition. I think, though, the challenge with our studies that we have are we don't know the difference, or we don't know the effect of truly transporting animals because we don't have any studies that show transported calves versus calves that remain on the dairy. And so I think we have to be cautious, particularly that study you mentioned about not making, not jumping to conclusions about duration or distance or things like that. And so I think, again, we need more data, but if we manage it effectively and that facility works to manage things effectively, then it's better for the calves. But we still have a lot of stuff we don't know, and we still have a lot of room for improvement.
I agree with that. And this was a retrospective study. They didn't randomize cow or calves, but the fact that they make sure they get enough colostrum, make sure they're healthy before they're shipped, seems to pay off, economically. So
I would
anyway,
agree with that. Yep.
And the Canadian studies, as a general rule, are complete system that are opposite to what most of our big dairies are doing, shipping to calf raisers. They're shipping their own load directly there, and they care about total protein, colostrum, and calf health before they let those animals on a truck. They're worth so much more.
And I think that is fair for some of the operations, but like I said, there was a lot of Canadian data, but there was some US data in there as well that shows that we do have room for improvement, particularly around fitness for transport. And that study I showed you, where over half of the calves were getting off the trailer dehydrated, those were all from large dairies in the Western US shipping directly to calf raisers. So there's room for improvement.
Yes, no, I agree that I hope we violently agree there's room for improvement. I'm just saying we now have some examples of where, when you do it right, you have amazingly low mortality and morbidity. So, and great calf growth. So anyways, I think we can set a standard to aim for. So
thank you.
Thank you for doing this.
Thank you.
Well, thank you for that question. And I think if I'm interpreting the Canadian system, when they require the calf being older before it gets on the truck, am I interpreting that there is a cash benefit that those buyers are willing to pay to have that calf older and coming in a higher health standard?
As far as benefits, I'm not sure, but when we look at transport regulations in Canada, they can't be transported longer than 12 hours. They if they're less than 8 days of age, they can't go through an auction facility. They have to be loaded and unloaded individually, have ample space to lay down. So I think I think it was Steve's point about Canadian systems being different, but there's also regulations around that as well that are that have been implemented recently.
Very good. Any other? Go ahead, Steve.
Okay. My concern is the Canadian regulations were based on what I would call extremely faulty studies. And we can show that if it's done well, you can ship a calf for 17 or 18 hours at 1 or 2 days of age And we don't want those kind of regulations based on Canadian studies to screw up the US system, personally.
Yeah, so I guess I would push back a little bit on that. So some of that data I showed you um, towards the end of like this study, for example, that was a very well executed study. Those calves were randomly assigned to different transport durations, and we saw them there be a benefit, or we saw transport be more difficult for on those calves the longer they were on the trailer.
Right. So why didn't Riverview find that? I mean, they obviously only had 100,000 animals, but or 300,000 animals, but they didn't find that at all. Gustavo's work.
So I think maybe I don't want to make I don't want to speak directly about Riverview because I don't know I'm familiar with their system, but I don't know it well.
Okay.
I will say that it's not that study didn't not find an impact of transporting calves. They found that calves going, because I believe it was calves going to different locations. And so it wasn't a direct comparison of transported versus not transported or duration of transport. So I think there's a difference there in what they were comparing.
Well, what they did is some were transported short distances and some were transported long distances.
Mhm.
I I would argue if you're interested in this topic, it would be worth spending a day at Riverview and watching the way they care about their calves.
And I have seen their calves being unloaded.
Okay.
Um, and I agree with you. They do a great job. And like I said at the beginning of the study, I'm not making blanket statements.
Yeah,
My job is to share the data that's out there, make us aware of that, and then talk about some management practices that we can use.
right.
And to your point about the study about those calves going different durations, they went different durations because they were raised at different facilities. And so
Correct.
that makes that comparison difficult.
I couldn't agree more.
Yeah.
And what I'm worried about is people using that one Canadian study and making laws or regulations or recommendations for the US because those animals were all one or two at a time, commingled locally. Some of them were shipped three different times. I for sure think that multiple stops and multiple shippings and multiple commingling is a bad idea. So,
Yeah, I would agree with you on that. I think like this study in particular, this GATS study, that was a really well done, well executed study by a lab group that um, really does great work in this space. And
Wait,
go ahead.
go ahead.
I was going to say, so I think there's pros and cons to every study, and we do have to be careful about how things are applied to different aspects or different parts of the industry. But I think the fact of the matter is that um, uh, transportation is stressful for calves, and we have to manage it correctly.
We've had a really great discussion here. Sandy makes the point that Riverview did not use an auction market in that system. And I think that is one of the things that the Canadians had into almost every one of those examples. Dr. Cramer, thank you for the information you shared today and the discussion with the audience. I remind everyone that this webinar has been recorded and will be archived on the I-29 Moo University webpage by the end of the week or by Monday afternoon. I will send out an email to everyone who registered when it is up. And I also ask you to complete the evaluation for the program. It's in the chat and it'll be included on the email that I send out. I invite you to next month's Beef on Dairy Dialogue with Dr. Alfredo De Canzo from University of Nebraska-Lincoln, discussing fiber in the beef and dairy ration on December 17th. You will be receiving that invitation early next week. Thank you again, Dr. Cramer, and thank the audience for attending. With
Thank
that,
you.
with that, I will be closing this webinar down.